Welcome to the JOMA podcast, presented by the Jewish Orthodox Women's Medical Association. Every week, hear from expert medical professionals as they share up-to-date insights on health topics to help you live your best life physically, mentally, and emotionally. Join us as we navigate the ever-changing landscape of healthcare and strive to improve the health of the Orthodox Jewish community.
Welcome to the JOMA podcast. I'm your host, Jennie Berkovich, board-certified pediatrician and director of education for JOMA. My guest today is Dr. Amy Comander, and we talked all about breast cancer, cancer prevention, and the role of lifestyle medicine in cancer treatment and prevention of recurrence. We also talked a little bit about running, so you'll have to forgive me for that. Dr. Amy Comander specializes in the care of women with breast cancer. She is the medical director of the Mass General Cancer Center in Waltham, where she also serves as the director of breast oncology and cancer survivorship at the Mass General Cancer Center in Waltham and at Newton Wellesley Hospital. She's an instructor of medicine at Harvard Medical School. She received her undergraduate degree and a master's degree in neuroscience at Harvard University. She received her medical degree at Yale University School of Medicine. She then completed her internal medicine residency training and hematology oncology fellowship training at Beth Israel Deaconess Medical Center and at Harvard Medical School. She is board certified in hematology and medical oncology and is a diplomat of the American Board of Lifestyle Medicine. Welcome, Dr. Comander. Hi, Dr. Comander. Welcome.
Hi, thank you for the invitation.
As I was telling you before we started, I've been a big fan of yours from afar. So excited to dig a little bit deeper into the work that you do. So before I start bombarding you with all these questions about cancer and malignancies, tell me a little bit about how you got into the field.
Great question. So, wow. Well, I think I always knew I wanted to be a doctor. And why is that? My dad is an internist. And so I grew up hearing his stories about some amazing diagnosis that he made that nobody else could pick up. And I would learn about the amazing relationships he had with his own patients. So as a kid, I kind of figured I want to do that when I grew up. And so I did end up obviously at medical school. And honestly, I don't think I knew I wanted to focus on oncology. I was really interested in neuroscience and psychology. I thought I might end up in psychiatry or neurology, but then along the way, I did a rotation in internal medicine and then in oncology, and I realized how much I love developing these very strong bonds with my patients. And that coupled with my interest in the science is what led me to pursue a career in oncology.
I love that. One sort of uncomfortable trend that I've witnessed, and I don't know if it's real or anecdotal, or maybe I'm just like at that life stage, but I've noticed a lot of people getting a cancer diagnosis, I think earlier than I would expect. Is that something that you're seeing that we're finding cancer? Again, is it maybe we're finding cancer earlier, or it's true that folks are getting diagnosed younger than they were in the past?
That's a really important question. And I will say there are lots of good news stories in oncology. For example, the American Cancer Society recently reported that, I'm a breast cancer doctor. So breast cancer mortality rates, dying from breast cancer have dropped by 44% since 1989. So that is amazing, right? Shout out to early detection and advances in treatment. However, a concerning finding is that there has been an upward trend in breast cancer incidence, particularly in women under age 50. And that risk has been about 1.4% per year greater over the period of 2012 through 2021. So, that is an unfortunate observation. Why are we seeing an increased risk in breast cancer in women under 50 and actually increased risk of early onset cancers such as colon cancer? Why are we seeing this? And I think this is an area that researchers are trying to figure out what the potential causes may be.
It feels a little bit like I think unexpected because I find that we know more than we ever did about prevention and about healthy lifestyle, right? And the importance of moving your body and eating, in a certain way. And so I think maybe despite that education, it sounds like maybe we're still seeing diagnoses made in younger patients.
Yes, I mean, you're absolutely right. We have we have such more of a deeper understanding about the risk factors for cancer, but still we are seeing this trend. And so trying to understand what could be explaining this. Is it due to some of the lifestyle factors that we know are risk factors for cancer, such as tobacco use, alcohol intake, excess body weight? But are there other factors that we're still learning more about, like the role of environmental factors, such as air pollution, or other factors in our environment, such as microplastics? So there's a lot of work we need to do to really discern why are we seeing an increased risk in early onset cancers. When I say that, I mean individuals diagnosed under age 50.
And I just want to emphasize what you're saying is that we think that there might be a link with all these factors, but we're not so convinced because I'm worried people will hear, oh, microplastics. Oh, I knew it. I knew we weren't supposed to have any plastic in the house, and like right, they're gonna go crazy trying to eliminate all of this. And what you're saying is like we're not so convinced that this is even a factor. We're just starting to learn about it.
I agree. I'm glad you said that. I definitely don't want anyone to listen to this to feel concerned about, their plastic Tupperware. Hey, I have plastic Tupperware too. But like, I think it's just one of many areas that's being studied, and we just need to be open-minded as, we're in the medical field, and researchers, public health experts, epidemiologists, to really try to use, the various research tools to figure out what could potentially be driving these findings that we're seeing. And, I did read an interesting article just yesterday about how tools from artificial intelligence will really help us analyze data from large populations to help answer this question further. So I agree with you. It's not just one thing, it's probably multiple factors, and we need to have a better understanding.
I mentioned to you before we started recording that I recently did an interview with a breast radiologist, right? So we talked a lot about the role of mammograms and MRI and things like that. Would love to hear your perspective on the importance of screening specifically for breast cancer and kind of how you've seen it evolve over the years, because I understand that those recommendations are changing.
Thank you for asking that very important question. I'm so glad that you just interviewed a breast radiologist. So, as a breast oncologist, I always share with those who are listening to me that mammograms are our most important screening tool for breast cancer. And I'll say it one more time. Mammograms are our most important screening tool. Mammograms save lives. And it is interesting to note that there's many organizations in the United States and around the world that give recommendations in terms of screening. But a highly respected organization here in the US is the United States Preventative Services Task Force. And they updated their guidelines for mammographic screening just a few months ago and noted that all women at average risk for breast cancer, and we can talk about what that means, should start a mammogram at age 40. Women who have risk factors for breast cancer, such as a family history on either the maternal or paternal side, or other risk factors, which we could talk about, may need to start screening earlier and may need to proceed with a breast MRI in addition to a mammogram. So these are topics that a woman should discuss with her gynecologist or her primary care physician to know what age would be ideal for her to start screening.
One thing that Dr. Zelenko, who's the radiologist that I spoke with, mentioned was that there are some recommendations of even having, I think she called it a baseline mammogram, even earlier than 40 for average risk women. Is that something that you're seeing coming out in your professional societies as well?
Right. So, again, there are many societies that make recommendations
Yeah,
for women. And I think for an average person who's like listening to all this, it's very confusing. There's
yeah,
just so much information out there. So I'm just sharing what the US Preventative Services Task Force recommends, because that's what most primary care doctors and
yeah.
family physicians would follow those recommendations. But sure, the American College of Radiology may have a slightly different take on it. So I do think my message to your listeners would be a woman should see her doctor
Yeah.
probably in her 20s and say, what age should I start screening for breast cancer? Do I meet criteria for genetic testing? And really kind of sort those things out in her
Yeah.
20s so she is ready when the time comes.
I think that's great advice because I have a feeling people in their 20s who are listening, hopefully we have some of those, are thinking breast cancer. Oh no, that's not a right now problem. Mammograms, that's not a right now problem. But you're saying like, wait a minute, you don't know yet, right? It could be something that you need earlier on, and it really has to be a conversation with somebody who understands your individual risks and your family history.
I definitely agree. I think like knowledge is power. That's one of my favorite sayings. And like it's always good, even when you're in your 20s, to be knowledgeable about your risk factors for medical issues that could arise as you get older so you can take charge of your health.
Do you find that there are common misconceptions about that people have about cancer, let's say diagnosis?
Oh, all the time. I mean, the worst thing I think I would say I see in my own
Mhm.
clinic as a breast oncologist is that women who beat themselves up for some reason say, well, I got this because of the stress I was under at
Mm,
work, or I got this because I had too many frappuccinos at Starbucks. They
yeah,
like blame themselves
yeah.
for why they got breast cancer. And let's just acknowledge there's no shame, blame, or guilt when it comes to cancer. There are so many things about cancer we just do not understand in terms of why one person gets cancer and another person does not. So I always tell my patients, just put those thoughts aside. They're not productive. Let's figure out your treatment plan and see how we can move forward. So that's a hard conversation that often comes up for me.
So it's not your fault is the main
Absolutely.
message, which is wild that you need to share that message with somebody who just got a cancer diagnosis. But I have a feeling women tend to blame themselves for a lot of
Oh,
things.
absolutely. And it's challenging for sure.
How have you seen, you mentioned some positive statistics that are coming out in terms of survivorship. How have you seen treatments for breast cancer evolve over the last, let's say, decade?
That is a great question and actually so amazing. If I just think about my clinic yesterday, I had a pretty busy clinic thinking about the patients I was seeing, some with early stage disease, some with advanced breast cancer. The treatment plans that are being recommended to my patients are like very different than maybe what I would have offered 5 years ago. So I think that's so amazing just in terms of the pace of research and the advances that we're making. So, for patients with curable breast cancer, which means early stage disease, we're learning about how we can maybe pull back on some treatments that maybe cause a lot of side effects and may not be needed, but move forward with more aggressive treatments for those who might need it to help them achieve cure. And then for our patients with advanced breast cancer, we're learning more about the pathways in the tumor that could be promoting growth. So we have new drugs that can target these pathways, and people are living longer with better quality of life. So I can tell you it's actually a very exciting time to be a breast oncologist.
Cancer is unique in many ways, but I find that one thing about it that I think is let's say unusual compared to other diseases is that the treatments there's so much variability, right? There's not like one standard, like if you have this type of breast cancer, here is the standard treatment. And there's still like a lot of research and things are ongoing. So I'm curious if you have a patient who possibly meets criteria for a clinical trial, how do you have that conversation? Because I wonder if, a patient who maybe didn't do well on the standard treatments and now you're bringing clinical trial into the conversation, is it something that they're wary of, or at that point they're kind of they'll go for anything if it means, a potential remission?
I love this question because, of course, I'm a huge fan of clinical trials, and all of the progress that we've made in oncology is because of brave individuals who have signed up to be on a clinical trial. And I'll tell you a quick story. On October 1st, the first day of Breast Cancer Awareness Month, my first patient in clinic that day, a lovely woman I care for who's in her 60s, who is on a trial. She has early stage breast cancer, and she's on a trial trying a new form of endocrine therapy, an anti-estrogen medication. And I just said, today's Breast Cancer Awareness Month, and thank you for advancing our field by being on a trial. You are giving back to all the women who are going to come after you and try to figure out, what is the best treatment for them. So the patient was so grateful that I said that to her. And I will tell you though, I really believe that. I'm grateful to every woman or man who's been on a clinical trial for cancer treatment because that is how we have made all these exciting discoveries. So I try to spin trials that way. Like I get it, a trial's not for everyone, but many people very much want to participate in a trial. Certainly it could help them, but also they'll think about how it can help the patients who will be diagnosed in the future.
I want to ask a question about one of my very favorite things, which is probably not something that people expect to hear on a conversation about cancer, but I want to ask about vaccines. Because I'm familiar with that there's some malignancies, I think primarily maybe solid tumors. I don't know if that's true or not, right? That there's evolving therapies, that there's vaccines targeted against the tumor as a way for possible treatment. Is that something that you're also seeing in breast cancer, like immunotherapy, that kind of thinking versus like standard chemotherapy approach as a treatment?
Absolutely, super exciting. So yes, I know at Mass General where I work, we now have a trial. I think it's about to open using a tumor vaccine for individuals with a subtype of breast cancer called HER2 positive breast cancer, which is about 15% of breast cancers in the US. So a certain population who of early stage patients who have gone through treatment and maybe meet the criteria to receive this vaccine on a trial can enroll. And you're absolutely right. It's really fascinating to harness the power of the immune system to help fight off and kill off cancer cells that potentially could be in the body. So I think this is a super interesting area that is emerging, and we're going to learn so much more over the next few years.
What are things, either in screening, in prevention, in treatment, things that you're maybe frustrated by or feel like there really needs to be maybe some fundamental way in the way we think about them?
Yeah, so I mean, I will say the hardest thing in my job, which I'm sure you could relate to this, is, when one of my patients, if her cancer progresses on her treatment and we need to switch treatments, and I know I've used a lot of the treatments that maybe have the least side effects, and now we're entering, treatments that perhaps have more side effects. So that's really, really hard and really challenging. And of course, when those treatments aren't working so well too. That it's just that part is very challenging. So I'm always, hopeful, and I try to instill this in my patients that because of research, because of investment in science, we're going to have better treatments that help people with advanced disease live even longer and have the best possible quality of life. So I'm grateful for all the clinical trial researchers out there who are helping push our field forward. So we will have more and more treatments for our patients. So that's really the hardest part of my job, as you can imagine, when treatments stop working and our patients get sick.
Is there anything that excites you that you kind of like look at your crystal ball and say, oh my goodness, in 5 years and 10 years, we're going to have insert what,
Well,
insert, fill in the blank.
Well, I have to kind of, I'm a little biased here because I have a particular area of interest in my field as a breast oncologist. So I'm really interested in the field of lifestyle medicine, and I'll define that for your listeners, really harnessing evidence-based lifestyle interventions that have been shown to help prevent the risk of certain chronic diseases such as heart disease, type 2 diabetes, hypertension, risk for stroke, risk for cancer. And we know more and more research is showing that these lifestyle interventions can benefit individuals with a history of cancer in terms of further lowering risk of recurrence, improving quality of life, and actually reducing risk of dying from breast cancer. And we're talking about things like exercise, a certain type of diet intervention, and many other factors. So this area, bringing more of these lifestyle tools, again, evidence-based research, not some crazy supplement you buy on the internet, like evidence-based tools to our patients to help empower them to live their best lives and hopefully treat their cancer. That's an area that, treat their cancer along with standard therapy, I should say. That is an area that I'm very excited about.
That's interesting. I think, my bias is when you hear about lifestyle medicine, you really think about it through a preventative lens, right? What are things that I'm going to do now to prevent chronic diseases from happening? Is there a place for lifestyle medicine in the treatment phase of chronic disease?
Absolutely. So I will say, again, I'm a breast oncologist, National Cancer Center. So I'm a firm believer in all of our amazing evidence-based treatments for cancer that I recommend to all of my patients. But I do strongly believe that the evidence supports the role of these lifestyle interventions along with standard treatments to help improve quality of life. And in many cases, specifically in the breast cancer field, which is my expertise, there's data that supports the role of these interventions. Again, exercise has been shown to significantly reduce risk of, recurrence of breast cancer in large studies that have really followed patients and, monitored their exercise activities. That's just one example. So I think this is an area that we're going to continue to learn more about. And I think great tools to empower our patients further so they can, there's so many things that happen to someone when they get cancer, but this is something a person can control for herself. And that's what's really exciting.
It's very empowering. Is there a specific type of exercise, or like what does the research actually talk about, that what truly seems to have a benefit linked to it versus what maybe just feels good?
Right? So there's actually a whole field called exercise oncology, where researchers are trying to figure it out almost like
Wow.
a drug. What is the dose and intensity of exercise that is most beneficial? But I'm just going to cite general recommendations from organizations such as the American College of Sports Medicine, American Cancer Society, American Society of Clinical Oncology. I can go on and on. Really, individuals should strive to achieve 150 minutes of moderate aerobic activity each week. So that could mean, something that you can do while, jogging, cycling, walking briskly, cleaning your house, Zumba, whatever you love to do. 150 minutes of that, and coupling that with strength training, which is so important, and doing that at least twice a week. And I'm not talking going to the gym and, picking up the heaviest weights possible. Like some of these strength training exercises people can do at home with body weight, Pilates, yoga. That's a great place to start. But these are really important that honestly all of us should be doing each week, but particularly our cancer survivor population. There's good data to support the benefits of this.
So specific, I just want to be clear because we talk a lot about on this podcast. We've had a lot of episodes on like wellness and lifestyle intervention. And again, it's through the lens of prevention. But you're actually saying, no, there's evidence to say that someone who already has a cancer diagnosis can benefit from exercise as a way to prevent recurrence.
Absolutely. There's good data in some types of cancer to support this, particularly in breast cancer and actually in colon cancer. So these are areas that actually the American Society of Clinical Oncology, an organization that I'm part of, and many oncologists are part of this organization, has in their recommendations now. Exercise should be recommended to individuals with cancer who are
Wow.
undergoing active treatment. So it is in
Wow.
our guidelines. Whether we're all implementing it is another story, but it is in our guidelines that we should be talking to our patients about the power and the importance of exercise.
That's pretty incredible. So one thing I just want to emphasize is that at no point are you saying we're using exercise instead of
Oh,
right standard treatment. I don't want anyone to think that we're suggesting you don't
right,
need chemo, go for a run. That's not what we're saying, right?
right.
But I'm curious. I mean, unfortunately, I've had a front row seat to individuals undergoing cancer treatment. It's very draining on the body. It's extremely taxing. Practically speaking, how does the recommendation to exercise fit into that regimen?
That's like the most important question right there. So we can make all these recommendations, but how do people actually implement it? How do we coach people with the behavior change piece? And it's really hard, especially for someone in the midst of treatment who feels poorly and doesn't really feel like they can
Yeah.
exercise. And I saw a patient yesterday. She's in the midst of chemo. She said that 4 or 5 days after her treatment, she has like zero energy. And I did tell her, coach her, I should say, like, can you walk 10 minutes a day for the next 5 days, just for 10 minutes, even if you're walking around your living room or walking to get the mail or just walking down the path outside your house and back inside? Like, just doing a little bit each day will benefit you. And I'll remember, I said 150 minutes, so it can add up over the course of a week. So you obviously, we meet our patients where they are
Yeah.
and work with them to help develop a strategy to help them achieve that goal. But I agree with you, that part is really hard.
Let's talk a little bit about the recommendations for diet. Are there certain either foods to eat, foods to avoid that there are current guidelines around specifically for individuals actively undergoing treatment?
Such a great question, because we know in the era of TikTok and Instagram and all the stuff out there in social media, my patients are bombarded with so much information, and it's really hard to discern what is evidence-based and what is not. And people are super confused, and everyone's telling my patients like what they should take and what they shouldn't take, and supplements, all that kind of stuff. So I try to keep it very simple. So organizations like the American Cancer Society, American Institute of Cancer Research, again, we want you to focus on the predominant part of the diet should be plants, fruits, and vegetables. So if you picture a plate, okay, picture half of that plate being fruits and vegetables, a quarter of that plate some type of whole grain, whether that's rice or pasta or quinoa, something like that, and then a quarter of the plate some type of protein. And we say protein, we mean obviously there's lots of great plant-based proteins, beans, legumes, tofu, that type of thing. But, chicken or fish are okay. The thing we really counsel people to limit is red meat really should be, if someone wants to eat red meat, really just at most once a week, and they really should eliminate processed meats. So processed meats, unfortunately, have been shown to increase risk for cancer. So,
What's an example of a processed meat?
you
Like
know,
deli meat?
yeah, deli meats, cold cuts,
Mhm.
those types of things.
Yeah.
Like, if someone like really loves those things, okay. If you have it once in a while, that's probably okay. But in general, should it be
Yeah.
on your plate every single day? No. You know what I mean? So when I talk about this type of diet, it's kind of what we call a whole food. I like
Mhm.
to say plant predominant diet because I recognize some people really enjoy having chicken and fish as their protein source, but plant predominant. And why is that important? We know more and more from so many interesting recent studies that having a diversity of plants, meaning fruits and vegetables, and herbs and spices in our diet really results in a healthy gut microbiome, all those bacteria and fungi in our gastrointestinal tract. And more research is also showing that, a healthy gut microbiome is important for so many health conditions, and in some cases, improving response rates to certain cancer treatments. Again, that's
Wow.
an area still in its infancy when it comes to research, but lots of fruits and veggies are so good for us. That's what we've always been told since we were little kids, and it's still true now.
And I noticed that you didn't say anything about soy or tofu. I know there's some mixed messaging around that and a potential links actually to breast cancer. Is there any validity in that?
So another great question, and actually that's another source of misinformation out there. So soy and tofu are safe for women and for women with a history of breast cancer. Soy contains a plant-based estrogen called a phytoestrogen, which works differently than our in our body than endogenous estrogen. And actually, studies have shown that soy consumption is associated with a reduced risk of breast cancer, and for cancer survivors, it is safe. So I tell people, think about whole food sources of soy, like edamame is a
Mhm.
great choice, yummy plant-based protein, tofu. The things I tell people to avoid are just some of these supplements and protein
Mhm.
powders that have concentrated soy that you're not really sure exactly what's in that. Like, you have to be careful. So, but I think whole food sources we feel are safe. And they're, again, I refer people often to the American Institute of Cancer Research website, which has lots of evidence-based information about nutrition. And there's some great resources there specifically about soy intake if some of your listeners want to look into that further.
I love that. Other than diet and exercise, is there any other piece of lifestyle medicine that fits into specifically the treatment piece or a response to treatment for people with a cancer diagnosis?
Thank you for asking. So in lifestyle medicine, there's actually 6 pillars that we focus on. So of course, nutrition and exercise
Mhm.
are super important. We both agree about that. But the other pillars include getting restorative sleep, stress management, avoidance of risky substances such as alcohol and tobacco and other drugs, and finally, what might be the most important, the important role of social connection and social support. So those are all the 6 pillars of lifestyle medicine. So while I'm talking a lot about nutrition and exercise, those other pillars are absolutely important too. And there's lots of research supporting, the important role of addressing those issues for individuals with a history of cancer as well.
I think it's so radical, at least for me, like it's so radical to hear somebody from like a mainstream, right, institution, someone who is an evidence-based oncologist say that these things are not only important in prevention. I know I keep saying this, but I just think it's so important. We keep hearing about how these things are important in prevention, but it's really radical for me to hear that they play a significant role in treatment and prevention of recurrence. So I think it really underscores how critical they are and how much we should pay attention to things like this.
Definitely. I mean, there's this whole concept out there, which you and I probably are familiar with this since this is how we were trained when we were learning how to become doctors, but this concept of whole person care. Think of the patient, but also all of the other issues that are related to their quality of life and well-being as a human being, right? So when we're treating a cancer, we're not just treating the breast cancer, like, yes, here's your tamoxifen and have your surgery and your radiation and all that stuff, but we also have to really talk to our patient. What are your social supports? How are you sleeping at night? How are you doing in terms of managing stress? How are you doing with exercise? Like, we have to attend to all of these issues to provide the best care for our patients and ensure they have the best possible outcome.
So we talked a lot about this, but I still feel like I need to ask. So I ask this question to I try to remember to ask this question to all guests. If you could tell somebody one thing, like a pearl maybe, or a main takeaway, if someone wants to avoid ending up being your patient, meaning they want to avoid cancer. We know that, right? There's certainly so much is out of our control, but what are, like, if you could shout it from the rooftops, like this is what you can control, what would it be? And I know we touched a lot on a lot of this already.
No, great question. I mean, first of all, there's a lot of unknowns about why someone
Yeah.
gets cancer. I mean, I see people who are vegan ultra runners who can get cancer. So there's a
We
lot of
actually have an episode with exactly that title. I think that's the name of the episode. Even vegan marathon runners can get cancer. And it
yeah.
was
So I think we should
specifically about this. Yes.
acknowledge that, unfortunately, like cancer is the leading cause of death worldwide, and we're all at risk for it, even the healthiest ones of us. But I guess when you want to think about what are some of the modifiable risk factors for cancer, what are the things we can control? And the most important one, which contributes to about 20% of cancer risk in the United States, is still tobacco use. So that's one thing. If you're someone who smokes, stop. And I know it's not so easy. I recognize that's very challenging for individuals who have been smoking for a long time, but that's the number one. The second factor in terms of modifiable risk factors is excess body weight. I know that's another really challenging one to address, but I think we do need to make sure people are aware that overweight, obesity is a risk factor for at least 13 different types of cancer. And it's just a fact, and it's just something for us all to be aware of. Again, knowledge is power. The third one is alcohol consumption. I think I read a recent statistic that actually over half of Americans do not realize that alcohol can increase the risk for cancer. And it's not just breast cancer, it's many different types of cancer. So being mindful of your alcohol intake is important. The other modifiable risk factors, thinking about your exposure to UV light and your diet, infection, physical activity. So those are all the things that we can all pay attention to help reduce risk of cancer. But remember, that does account for perhaps up to 40% of cancer risk, but there's a lot of factors that we don't fully understand.
I love that. And I'm going to ask one final question, but this is just I want to know question. It has nothing to do with the topic, but maybe it does. I know you're a runner, so I would love to hear about your last race and what you're currently training for.
Ooh, well, I'm so excited to talk about my last race. So my last race was actually just a few days ago. So I grew up in Savannah, Georgia, in the South. Actually, my parents were New Yorkers, but that is where I grew up. And I will say that this weekend, for the first time ever, there was this race called the Every Woman's Marathon, the first marathon dedicated to female runners. So it was super exciting. There were over 7,000 runners. 40% of them were running their very first marathon ever. How
How
cool is
cool.
that?
That's
And there
super
was just
cool.
so much support, so much spirit, so much grit, so much resilience, so much camaraderie. It was really an incredible experience. And I was so happy that it was in my hometown where I grew up. So I just did that. I'm feeling good today. And so that was super fun. So I think they're going to have it again next year. So if anyone's listening and contemplating in the contemplative stage of should I train for a marathon, sign up next year because it's a lot of fun.
That sounds awesome. Actually sounds really fun. I was looking at pictures and was wistfully looking at it. So if you know anyone on the planning committee, maybe you can convince them to move it on a Sunday. I think it's a Saturday
Oh,
run, so a lot of us that are JOMA runners, we're limited by that. So maybe you can nudge them to move it to a Sunday race. Are you currently training for anything, or you have anything on the radar?
well, I'm kind of recovery mode from that because it was just a few days ago, but I am excited. I live in Boston, as you know, and so I've been running the Boston Marathon actually for the past, I've done it, I have to think for a second, 11 times for charity,
Wow.
by the way. I run for charitable causes. So I just found out that I did get a number for this April of 2025. So
Okay.
no, I am not training yet, but I will be.
Oh, so it's coming. Okay, so this
Yes,
upcoming. Okay, so we'll see you in Boston. That's amazing.
absolutely. I'm excited about that. Yes.
Awesome, awesome. Okay. Well, Dr. Comander, thank you so much. I really thank you for your time and for this amazing conversation. Thank you so much for the incredible work that you're doing.
Thank you so much. It was a great conversation. Love meeting you.
Thank you for listening to the JOMA podcast. We welcome your feedback and ideas for future episodes. Send us an email at health@joma.org. Don't forget to subscribe, rate, and review us on your favorite podcast platform.